In-depth coverage of the top stories and breaking news when it happens. News Radio 1080 KRLD.
Hi, everyone. Thanks so much for joining us for Ask the Expert, North Texas. I'm Kristen Diaz.
I'm David Rankin. This weekend, we get back that hour of sleep that we loaned out in the spring. Sunday, the end of daylight saving time. Now, there's something about changing the clocks that does a real number on our bodies and our sleep schedules. The time change known to cause problems like seasonal affective disorder, more car crashes, and sleep issues. But this time change can also do a number on our hearts as well. On today's Ask the Expert, we are joined by Dr. Fahmi Farah. She's a cardiologist and a director of the Bentley Heart Institute in Fort Worth. She is in the KRLD Zoom room. Doctor, thank you so much for the time. I think we're locked up. Okay, we're good. What is it about a single-hour time change that seems to cause so much trouble?
Yes, our bodies are really in tune to circadian rhythm. That's a very important rhythm because that's what determines our sleep pattern. And people with sleep disturbance, they have a hard time adjusting to even slight changes like a delay or, now we gain an hour. So, it's a pattern, and as a result can cause more stress, affect our blood pressure rate, and ultimately more serious things like heart conditions.
Now, what's the difference between daylight saving time and that 1 hour of sleep versus having to wake up early for an appointment because that was the only time you could go see the doctor is at that first 7 a.m. appointment and you're losing an hour of sleep out of your normal schedule, for example?
I think the big difference is that, one appointment is like thing, whereas a daytime saving something you have to deal with every day for some time. I mean, people eventually adjust, but at the beginning, several people. Now, I agree with you that one shouldn't make that big of a difference, especially when we have so many other. But like I said, for some people, they really are sensitive to that circadian rhythm. That for them, it ends up being a disturbance, and it takes a while for them to adjust. The road, they have to readjust, so it can cause a disruption to many people's schedules and their health.
Do people tend to overestimate how daylight saving affects them, and it really might not affect them as much as they think?
So I think in the big scheme of things, just 1 hour difference, honestly, does make that big of a difference in anybody's health or schedule. But different people, they have different sensitivities.
So when, as a doctor, what is the advice that you're giving your patients as we get closer toward the day?
My advice to everybody would be adjusting around that time. What I mean by that is, some people who are super sensitive to that 1 hour change, I ask them to do it gradually so that they're not feeling the effect of the change as much, so it doesn't affect their circadian rhythm. So what they can do is, instead of just going to sleep an hour early or hour late, why not do it in 20-minute increment? That way your body slowly adjusts. We allow it time so that it gradually adjusts and it doesn't affect your circadian rhythm as much. So I think that would be my advice to everyone.
We always hear as well that issues from daylight saving time, we see and hear about car crashes going up. Why is that?
I think, again, it comes down to the quality of sleep. A lot of people are stressed out about it as well. So as a result, maybe even that 1 hour might not have made as big of a difference, but as a result of the stress, they're probably not even sleeping the whole night. So it could be that because of that lack of sleep, they're not as well rested. They're not able to focus as well. And as a result, they're getting into car wrecks because their focus is just not there. Their attention span is affected.
And what is the long range issue when we deal with this every single year, and even in between seasons with our heart health? What is the most important focus that we need to have with either managing, sleep time, rest time, and just day to day?
Sleep is very important. Sleep disturbance is a risk factor for heart disease. American Heart Association just added that as a new risk factor. And so I think sleep is very important, just like taking care of your other conditions, risk factors like high blood pressure, diabetes, high cholesterol. Sleep is now part of it. So, even aside from this time change, I think a lot of people who have sleep apnea or are just not able to sleep very well, they should seek help. They should talk to their physicians and get to the bottom of why they're not getting adequate sleep or restful sleep, so that they can, if there are treatments available for different types of conditions, so they can get the proper treatment for it. Now, in terms of how much daytime, like the daylight saving time is affecting our health throughout the year, in my honest opinion, I don't think it's very high, because it's only 1 hour difference. And, now we're actually gaining an hour. So I don't think it should be causing anyone any kind of stress, because you're actually gaining 1 hour. But again, it's something that we can easily work around. As I said, you can gradually introduce that change to your schedule in increments of 15 to 20 minutes until your body gets adjusted to it. So overall, in the big scheme of things, I don't believe that this 1 hour has a huge detrimental effect on our overall health.
Does it affect certain generations more? Are children more likely to feel this with their circadian rhythms versus, say, older adults?
I think it does. It's more difficult for children and the elderly to adjust to their circadian rhythm if there is a change. So yes, I do think that it can affect them. And so toddlers, schoolgoers, the parents can help by implementing that gradual change into their schedule. Same thing for the elderly.
Dr. Fahmi Farah is a cardiologist with Bentley Heart. Thank you so much for the time.
Thank you for having me. It was a pleasure.